Hi, good evening everybody. My name is Maryke from sportsinjuryphysio.com, where you can get online physiotherapy appointments via Skype. Now tonight's session is all about hip bursitis, or if you want the full-on name, it's Trochanteric Bursitis. I'm going to call it hip bursitis because my tongue doesn't want to get around the other one. In tonight's session, what we're going to cover is, let me just get it up there. Actually, if we go to this view. We're first going to look at what is a bursa, especially in the hip. Then why does it get injured? And how do you diagnose it, that it is hip bursitis, because there's plenty of things that can give similar symptoms. And then lastly, we're going to look at treatments. So various things that can help or may help it. Now, if you're new to the live streams, how it works is if you've got any questions, feel free to ask them in the comments and I'll answer them either along the way or I'll come back to them later. And if you're watching this on replay, make sure you tag me in there. My name is Maryke Lowe, so if you tag Maryke in there, then I'll know that you've asked it and I'll come back to it and answer it for you. Excellent. So let's get on with it. So what is a bursa? Now, a bursa is a fluid-filled sac, and everywhere where you've got tendons or muscles close to bone, do you have these little fluid-filled sacs, and their function is to stop friction in the body. So another common one that people injure is the one in the shoulder, where it's underneath the bone between the two shoulder bones. But for the hip, let me quickly get this picture up, then it'll make more sense. So for the hip, you can see you've got plenty of bursas in the hip actually. And that's because you've got loads of hip muscles. If you think about it, you've got your glute max, which is the big muscle at the back. You've got your glute med there. Underneath it, you've got your glute min. You've got your piriformis muscle deep inside. And then you've got loads of other little smaller muscles in there. And all of them have tendons that come and attaches into the hip bone. And if you look at that bit, the bone that comes diagonally down, that's where the hip fits into its socket. And then that's top of the thigh bone. So around... let me just get my top of my, there we go, around this area. And this is typically where you can feel the pain from bursitis or hip bursitis. Now, take note that there's not just one bursa. There are, in this picture, there are 9 bursas. And from what I've read in the past, not every person has every single one of those bursas. Some people have more, some people have fewer. And quite often, it's more than one of these bursas that's at fault. So for instance, if we think about injections and stuff, sometimes the reason why an injection doesn't work is because they've injected the wrong bursa. But I'll get more or deeper into that detail later on. So for now, if you can think of a bursa as a nice squishy fluid-filled sac that is between tendons and bones, and sometimes just different layers of muscle. So if you think of where the IT band crosses over that area, there's a big old flat bursa right there as well. And the main aim is to stop friction in that area. Now that brings us on to why it sometimes gets injured. So you have 2 main reasons why it will develop into a painful bursa. The other thing I've got to mention is that bursas, beside the fluid that it's got in it, it's also got loads of nerve endings. So when it becomes inflamed and sore, it can create a lot of pain. Now, you can upset your bursa either through sudden impact. So here we're thinking of a fall onto that side. So falling off your bike, tripping over, falling on it. And it usually sets in within a few hours or day or so after the impact. And in those cases, it's very often just the bursa that's the problem. The other more common cause is through excessive friction. So yes, it's there to stop friction from happening, but if for some reason it's really being squashed and grinded more than what it wants to be, then you can also get a painfully and sometimes inflamed bursa. I say sometimes inflamed because actually what the research has shown is that bursitis doesn't always go hand in hand with inflammation in the bursa. Sometimes it does, sometimes it doesn't, and that's why anti-inflammatories doesn't always work for it either. Now, things that can cause excessive friction there. Again, I want you to think of the anatomy because then you'll understand why it can cause it. So I'm going to demonstrate it on myself. Let me just get this back so you can see my hip better. So I need you to picture the fact that you've got all your little bursas lying at different angles in this area. Now, can you see that if I did that, I would pull all the muscles and especially the IT band tight over this bit. So potentially I can squash the bursa that's just there, and then if I walk like that, I'm going to grind it, and that can cause it to become irritated. So if you think of how catwalk models walk, like that, that's actually called Trendelenburg sign. And we don't want people to walk or run like that because we know that that can cause a variety of different injuries. Another example is if I, for instance, step while running or walking and my knee turns in excessively. I'm actually going to bring this down a bit even more that you can see my knee better. Get my chair out of the way. So if you can imagine this, when I make contact with the ground, my knee goes in. Can you see that in this case, it's going to pull all of these muscles and structures tight over that. So potentially squashing some of the bursas at the back there. So if we think of reasons why that would happen, why your hip would drop and your pelvis would drop and your knee would move in, one of the main reasons is if you have glute weakness. So when you're not strong enough around your core muscles. It can be habit sometimes. It can also be if things get tired. So if you think of overuse, where you do repetitive movements too often. So for instance, a good example of overuse is if you do an excessively hilly race or go and do a lot of hill walking and you've not actually built up to that. You can become really tired and lose your form, or the bursa can just be squashed so many times that it's not prepared for. Because the bursa is like all things. If you slowly increase the amount of pressure it's under and you do that over time, it will adapt to it. But it's when it doesn't get time to recover that it becomes a problem. Excessive tightness. So that can be in any of the muscles that surround that area. So if we think of the IT band crosses over that, so your tensor fasciae latae can play a role. You've got your piriformis muscle, your glutes, any of those muscles that's too tight and compresses that bursa over time can cause it to become inflamed or tender. And I will talk about this a little bit more in a minute. But conditions like if you've got ongoing lower back pain and you don't do exercises to keep your mobility and flexibility up there, I often find those patients can have a type of bursitis develop as well. And if we can loosen those muscles and structures off, we can often improve their pain. So you may have other conditions that then causes things to become too tight there and irritates the bursa. And lastly, there's a condition called snapping hip, where your IT band actually, as you walk, goes click, 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 click over the outside of it. That's actually more common in people who are hypermobile or people who like dancers, for instance. That's probably the most common patient load where I've seen, or patient demographic where I've seen snapping hip. But you can imagine if that IT band keeps on flicking over it, it's going to eventually irritate that bursa to the point where it's going to become inflamed and painful. Okay, now what I also didn't put on there, thinking about biomechanics again, and if you stand like that, it's going to annoy this one, or if you stand like that, be careful of bad habits. Think about how you stand when you're standing. Do you have a habit of when you stand for a long period of time to hang off one hip? Because if you're going to stand like that for a significant amount of time, you can annoy it again. So take note of little things like that. Now, if we move on, that brings us to diagnosis. So, the pain that you feel from bursitis can be easily confused with other conditions, and other conditions can be easily confused with bursitis. And that's because the pain is not specific to bursitis. There are several different things that can cause pain in this area. So, bursitis pain is usually on the outside of the hip, but it can refer down the side of the leg. It can also, if it's bad enough, tighten up your lower back and make that hurt. If you've got lower back pain, it can refer pain into the side of the hip. It can refer pain down the side of the leg. Glute med tendinopathy, where your glute med muscle runs roughly in this area and the tendon comes and attaches in there. Now the tendon is in exactly the same spot as where your bursa is. So if the one is painful, you're not going to know which one it is really from just pressing on it. Also, if you've got a tear in your glute tendons, that can feel very similar again. The big difference lies in how the pain developed. So, for instance, if we're thinking about a tear, it's often something that develops quite suddenly. If we're thinking about a history of back pain, then you'd suspect back pain rather than pure bursitis. Then we also want to look at how it behaves over 24 hours. Like, for instance, if you are okay to do lots of weight-bearing activities with it, that it doesn't really make it worse, I would really not think that it's bursitis. If you can stand for long periods of time, then bursitis don't really like standing for long periods of time. Things like stretching it. If you found that stretching it may, and you can't sit with your legs crossed, that makes it a lot worse, then I will think that yes, there could be a bit of bursitis there. Now, there are certain tests as well that you can do. For instance, one of the most common things that people do is they press in there, and if it's painful where they press, they say, okay, that's bursitis. But actually, the research have shown that that's not very accurate. Two of the tests that's the most accurate is one where you just stand on that leg, holding the position. Now, that's accurate for that, but it could also identify glute med tendinopathy, so it can't really decide between those two. Another thing that could be painful is if you contract your hip external rotators against resistance. That can cause pain if it's bursitis. But again, you've got to marry it up with the other history of how the condition started and the behavior over 24 hours to get your diagnosis. You can't just go for one test or where the pain is. I would really say just chat with somebody who's got some experience with this, and they should be able to help you distinguish between the lot. And to be honest, moving on from that, it's not always necessary to distinguish between it all, because often you will get that you will have back pain, but you'll have bursitis because of the back pain. So you've got to treat both of them. Or what they've also found in the research is something like 35% of people with glute med tendinopathy also have bursitis. So it's more about testing for the symptoms and testing for what makes it better and worse, and then treating according to that. You don't always need the right label on there. You need to be more clever about listening and identifying what things makes it worse and what makes it better, and then reacting to that. Now, as with all things, there's not one size fits all when it comes to treatment. And conservative treatment, which consists of all of the things I've listed there, can work really well. A small percentage of people don't react to that, and they do surgery for it. I've not had anybody, any of my patients go for surgery. Usually the worst that they have to go for is a cortisone injection. But let's run through all of it. So the first thing is identify the cause. Because if you don't fix the cause, you may get rid of the pain, but then it will come back. So you've got to figure out what has brought on your bursitis. Was it just that you fell on it? Sudden impact? Then, to be honest, don't worry about the cause too much, because it's basically direct impact. It's just about getting the symptoms better then. But if you've got a feeling that it's how your leg moves when you're running or walking, it can even be shoes. If the shoes are too flexible and allows your leg to turn in even more, that can be part of the cause. It may be that you just upped your training way too quickly and it wasn't ready for it. So you've got to look at your training schedule and maybe do some changes there. Was it that you did a lot of downhill running? Because when we run downhill, the temptation is always there to really pound it, and then your leg can turn in more, which will cause more compression there. So identify that cause. Then also look at your habits. Do you have a habit of standing hanging off one hip? Because if you do, that's the first thing you need to stop. All my patients with bursitis, or to be honest, any pain around the outside of the hip, I always get them to make sure that they're always standing on both feet equally. Because otherwise you just annoy those sensitive tissues the whole time. Hand in hand with that, watch out if you've got a habit of crossing your legs when you're sitting. Again, you will be stretching this bit. And if you've got a sensitive bursa or even a sensitive glute tendon, it's not going to like it, and you may just keep that pain cycle going. Now, choose your exercises carefully. And I can't say this loudly enough or clearly enough, because what we know is the test for bursitis is doing resisted external rotation, and also you can do an abduction test. So if you're going to give people clams or side leg lifts to do, you're likely going to make that bursa feel worse because you're going to compress the bursa through those movements. So if you feel that biomechanics and muscle strength was part of the reason why the injury is there in the first place, you've got to start strengthening them. But remember, if you do things like a glute bridge, or you do something like a leg press, even though the leg moves in a straight line, you're still getting strengthening or activation of your glute med muscles. So those type of positions is sometimes a safer option. Also things like an isometric wall sit rather than a repetitive squat motion, because the more that you get movement through that area, the more likely you are to grind it and get more friction. So you're much better off finding a pain-free range and holding the position so that we're getting isometric strength. Okay. Strengthening exercises is not my first choice for this condition. They have to be properly calmed down first before I introduce this. Otherwise, you tend to really just make it worse. Stretches, I tend to avoid all stretches at this point. Because 9 times out of 10 you will just make it worse. If you don't make it worse through stretching, I'm going to go as far as saying that it was likely not a proper bursitis. It may have just been sensitive from other things. But what do you do about it if you think that tightness is the issue? So massage, be that self-massage or a physio or massage therapist with an elbow in your bum, works really, really well, because if you can get those muscles to relax, you'll take the pressure off the bursa. Now, it's not about pressing onto the bony bits where the really sensitive spots is. You start from the less sensitive areas and work on the trigger points and things. You don't want to elicit that strong pain, especially in the first session, because if you go too heavy on it in the first session, you won't know how it's going to react, and it may cause it terribly to flare up. So even if you're doing it yourself, it's much better to ease into it. So if you're thinking of self-massage with a tennis ball or something, I would do it against the wall rather than on the floor, because it's much easier to actually decide how much or limit the amount of pressure you put through it. So do I actually have a ball here? Let me just quickly have a look. Oh, the random things I keep in my room. No, but this may give you an idea. So just imagine for a moment that it wasn't 2 little balls on there, it was just one big ball. What I would do is you place it so that it goes into the soft, squishy bits where the tender spots are, but not where the painful bursa is, just where the muscly bits is. And then I'm going to shift this slightly further back that you can see what I'm doing with my other legs. So what I'm doing is I've got that bit in there, and then the leg closest to it is totally relaxed. It's just hanging. I'm using my leg furthest away to press myself into the wall so that that ball is creating a pressure point onto the muscle. And the nice thing about doing it standing up is you can decide how much pressure you put through it. And honestly, especially for this, it's got to be comfortably uncomfortable. Now, I've been there myself. Sometimes if you've had pain for a long time, it can feel quite satisfying to really replicate that pain and feel how it burns. Please don't do it with this. Do it gently, see how it reacts in 24 hours, and then decide how you go from there. Whether you can go a little bit harder or whether you should just stay at the same level. Dry needling's on that list as well. I find it extremely useful. I have found a study that found that it had similar results to cortisone injections. I would want that study to be repeated before I take that for gospel, because I've definitely seen in practice that for some people it just doesn't work and they do need to go on to injections. But especially in the very painful stage where you can't put a lot of pressure even from massage, I find that acupuncture can provide really good pain relief and relaxation of the muscles. Okay, then we get on to injections. We're talking cortisone injections here. Now, you can do a cortisone injection in 2 ways. You can either go on the landmarks and kind of decide according to that where the bursa is and do an injection into that. Or you can do an injection under ultrasound scan. So you know the scans where they look at whether you're pregnant and how the little baby looks. You can use those scans to look at different soft tissues in your body, so different muscles, the bursa shows up on that and everything. And what, like for instance, the sports docs and some of the physios do is they use the ultrasound to see exactly where they place the needle so that they can see that they're actually injecting into the bursa that they want to inject into. And it's worth remembering that there are several bursas around that hip. So it may be that more than one is inflamed. So scanning them can give you a good idea of which ones are the problem ones and which ones you should be injecting. So I always tend to refer my patients to somebody who will be doing it under ultrasound guidance, just because I see better results. But if you've got somebody who's really experienced in injecting blind, as we call it, it can also give good results. So it pretty much depends on the person injecting, but I would always go for the ultrasound guided. With regards to medication, in this instance we're talking about anti-inflammatories. Again, it's one of those weird conditions where sometimes there's inflammation, sometimes there's not. So for some people it works really well, other people it doesn't really work. Always check with your GP before you take it, because there's certain medications that it interacts with, and especially anti-inflammatories has a way of upsetting stomachs and burning the lining of your stomach and messing with your gut. So if you can get away without using it, it's always better. Good. I think that's pretty much what I wanted to say. So I guess if I have to think about my treatment approach for a patient with bursitis or bursitis type symptoms, is I would first of all identify what I think it is. Often it's a combination of things. So often it may be a combination of back pain or lower back issues plus bursitis, or glute med tendinopathy plus bursitis. Your first thing is to calm the pain down. So you try and avoid all the things that aggravate it, like crossing the legs, standing in funny positions. If it is stability that it lacks when you're walking, try to give it by wearing the most stable shoes. You work on the flexibility of the muscles and things around it, but without upsetting the bursa. And then lastly, if it is needed, you do some strengthening exercises, as well as eventually you can add in stretches, but I would leave that for last. There's different things you can do to get the same results. Very well. So remember, if you need any help with any injuries, you can consult me online via Skype or WhatsApp or any video call of your choice. Nice thing about the video calls is I can see you move, I can take a full-on history, and I can basically work out a diagnosis and a treatment plan like I would do in a regular clinic. So if you need any help, have a look. I'll pop a link in the comments or in the description of this video. Take care. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.